Question on the front row up here, and then we'll go to the back row.
I didn't hear any mention of SSI at all in the discussion today when we were talking about adequacy of benefits. And if we look at it historically, it was really intended as a safety net for older persons as well as the disabled. Now, we know that the numbers of older people receiving this benefit have been steadily going down, so you could say it's a success. There are people who don't share that view, though, who say that the benefits are inadequate and the eligibility rules are so strict that it's difficult to get on. When you look forward to the issue of reform and benefit adequacy, is SSI going to be part of the picture, or do you think that's not a good idea, or an obstacle, or an aid, or how do you see SSI fitting into your views?
Who wants to take that one?
I'll start.
Ken will start.
This report really looked at Social Security. We need to look at SSI as well. This is a very important program that can provide a foundation for some very vulnerable populations. I think there may be a tendency from some to just say, hey, this is vulnerable populations, let's let SSI take care of it. And I think that SSI can play an important role for a very targeted group. But from looking at that graph up there, we're looking well beyond that. So 2 points. One, should SSI be part of a relook at how to provide more of a foundation? I think it should, and it really very much should. Two, is it the answer? I would say a little bit of the answer. That would be my assessment on it. SSI should be, we need to do some work drilling down on SSI as well, but don't expect miracles from the SSI program. We don't have so as the SSI program, the social assistance piece of our system is quite small. It's been declining over time because Social Security has become increasingly universal. So more of our answer is going to have to be in the Social Security piece, but some of it ought to be in the SSI as well, it seems to me. That's a personal opinion. It's not really a NASI position, but
Well, I can't speak for Nancy either, but I think that what Ken says makes a lot of sense. Certainly the SSI program has been neglected. The asset tests, the resource tests are extremely antiquated, and it's a very important program for working people with significant disability, and those resource tests.
You can have almost no financial assets and qualify for SSI is a real deterrent to receiving it. Also, quite frankly, so it needs to be updated, but also relying heavily on a means-tested program. The test of means is cumbersome to administer, and it would be very cumbersome if we had a very
Good effect on the federal budget as well as on the national scene. Because the cost increase is just out of proportion to most everything else. Social Security is in a completely different place. We're still bringing in more money than we're paying out. So it's and the long-term picture is radically different from what we're looking at in the various healthcare predictions. Other pieces of entitlements are going to each require their own window, their own look. So I think the key thing in any, as we look down the road, the key thing is not to get caught up in some macro across the board, whatever. Across the board, in my view, never works because you have to look at the pieces and put it together. Yeah.
And I just add, to reiterate the same point, within the context of a broader package, if it's a universal package looking at all kinds of pieces of a reform endeavor, what it's going to come down to is how does that package deal with long-term solvency and financing, and how does it deal with income adequacy? The same key questions, whether it's within a package that is broader than Social Security or separate than Social Security. The two mantras should be what's going on benefit adequacy, what's going on long-term solvency. So if it is within that context, I would think the same questions apply. In other words, whatever the vehicles may be, the same two questions ought to be held up. The same two tests ought to be held up.
There was a question back over there, and then we'll come back up to the
I'm not going to identify myself because I don't want anyone to think I'm speaking for my organization, but I want to say that I personally am not yet a fan of the prospect of paying for increased survivors' benefits by reducing the spousal benefits. And I wonder, has anybody done an assessment of the distributional impact on retirement income security of couples in the event of a reduction in those spousal benefits? And I would think this question is especially important given the continued reliance on Social Security of so many individuals and couples, and the fact that they're not getting all that much money from Social Security right now.
Do you want to take that, or shall I boot it to Steve?
I think you're raising a good question. Some of the distributional analysis has been done, but it depends on the past, and we need updated distribution.
We need updated distributional analysis. Has it? Do you have an answer to that question, Melissa? And ask your question.
Melissa Favreau from the Urban Institute. I think we're in the process of updating a lot of the distributional analysis on spouse and survivor stuff. We have some of it on our website, and we're planning to do a series of briefs, also through generous funding from the Rockefeller Foundation. So that's something that I think we're eager to stay in touch with folks about, in particularly in exploring alternative design issues, because I think there are a lot of important implications. And that sort of leads into my questions and my comments. My first comment was that I wanted to commend Virginia on the report, and also commend you in particular for targeting benefit adequacy or for referring to benefit enhancements that were very well targeted. I think that that's super important given the financial constraints that we're facing as a society, that we target benefit enhancements well, and I appreciated that list of things. I had a couple of just kind of technical questions. One thing that's been raised in the past is the preferential income tax treatment of Social Security benefits, or what some characterize as a preferential tax treatment. I didn't notice it in the report, and I was wondering if that was deliberate, and if so, was it a philosophical, distributional, or political reasoning for that? And then the second question was just if you could, the salary reduction plans is something that's relatively new to me. I'm wondering if you could expand on that and talk about the potential for feedback effects that I think sometimes is expressed as a concern when the tax treatment of employee-type benefits is changed. Would there be any concern about erosion on those benefits as a consequence?
In answer to your first question, this report is far from exhaustive, and certainly changing the tax treatment of benefits is an idea that's been around. I don't know why we didn't include it in our report. It wasn't a conscious exclusion, but there are lots of ideas that are not in this report. On the tax treatment of 401 or these salary reduction plans, it's an idea that we saw raised by, I think, the Joint Committee on Taxation, 4 or 5 years ago. And it's an interesting idea I hadn't heard talked about much, and said, well, let's give some visibility to this idea. Essentially, it relates to this growing tendency of employers to offer their employees the chance to put money aside in a tax-favored basis for dependent care, for unreimbursed medical expenses, for the cost of commuting to work, and heaven knows what might be next. And to the extent that increases, it erodes the Social Security and Medicare tax base. And back in 1983, when the Social Security legislation was passed, there was a conscious decision to say, okay, 401ks, if you exempt them, contributions, if you exempt them from both payroll taxes and income taxes, you are eroding the Social Security and Medicare tax base. You are also saying that those wages of the workers are not going to be replaced by Social Security benefits, and yet they are, in fact, wages that might need to be replaced if the person is to get an adequate income.
So let me emphasize that last point is in the 83 amendments. This was an idea that was brought to the subcommittee, much to our surprise that somebody actually came in and asked to be taxed. But it was, but the concern that was expressed was that you didn't want to put people in a position of reducing their Social Security benefit because they were saving money for retirement. You know, this was like, huh? It didn't quite compute, and the concern was that that all of your wages should go to build up your Social Security benefit, and then these monies that you were putting aside that were that escaped the income tax, that was fine. That was a different kind of decision. But the concern was not to reduce people's Social Security benefits over the long term.